Okay, welcome to True Health Tuesdays. Okay, tonight we're talking about cervical spine and shoulder. It's tough because you can't speak about the cervical spine unless you talk about like all the other things. So this is going to be like a rough overview. When we talk about the neck area, it involves headaches, carpal tunnel syndrome. It involves shoulder pain, rotator cuff problems, bursitis in the elbow. We're talking cancer, neuropathy, breathing issues, all from the cervical spine. Now, we talk an hour on each one of those. So it's going to be kind of like a rough overview that we're going a little bit too fast on. Okay, but it's going to make sense. Now, this is the side view on the right here of a normal curve in the neck. See, the body should be straight up and down from the front and should be curved from the side. Dear, can you grab me the spine out of that room on the right? And so this way we've got straight up and down from this direction, but beautiful curves on the side for shock absorber. Now what happens in pathology and problems, if we lose the curve, oh, thank you. You did excellent. Yes, she's a professional spine carrier. Okay, so from the side, okay, we've got these beautiful gentle curves. Now what happens, if we lose the curve in the neck, now remember, this head weighs around 12 to 15 pounds, so it's balanced over this. So it's like a shock absorber, like a spring. So for every 1 inch that heads forward, the pressure on these discs double. And so what happens is the more we lose that, it causes a stenosis or narrowing. It actually tractions the entire cord. So when you bend this, the cord is loose and flexible and has room to move. The more that neck gets forward, the more it pulls that spinal cord, and that spinal cord affects the entire body. Now, when you look at the neck, we're also going to talk about how the brain doesn't stop at the skull. It extends its top portion of it down. But the body's really intelligent. And so when you look at this neck on the left, that's actually a reversal of the curve in the neck. Now, there's a ligament that runs down the inside of this area right here. Now that's called the posterior longitudinal ligament. In order to bend the spine so far that it's reversed, that means you injured or tore that ligament. Now the ligament can be regenerated by just pressure over time, the same way a dentist would reshape teeth. You can actually reshape the spine and restore it, and that's a before and after x-ray. It took about 90 days. But when you look at this, what kind of things are associated with the neck? Headaches, carpal tunnel syndrome, shoulder pain, rotator cuff problems, breathing issues. So now when we look at this, I think one of the most important aspects of this is the neurology behind it. Now, you've got an artery that comes up off of the heart called the carotid. Now it splits into two sections, and it's got one that goes inside of the skull, and that's called the internal carotid. The other one goes outside and covers the facial area. That's called the external carotid. Well, right at this junction of these two arteries, now I taught human dissection anatomy, so this doesn't look gross to me, but that's a cadaver sample on the bottom. And that's what we would do. We would take cadavers and I would mark them and stick pins, and then the student doctors would come around. Well, right at that junction, there's two sensors. Now think of this. It's almost like your body's like a spaceship from NASA. These sensors, one is a carotid body, the other is a carotid sinus. What they actually are, one senses carbon dioxide, the other senses pressure. So now think of this. If pressure goes too low, and knowing that this brain burns 25% of the body's oxygen, if blood pressure goes too low, guess what the body's got to do? It's going to keep that brain alive. It's almost like if you were to sit on an iceberg and your core temperature started to fall, the blood vessels would start to constrict, so it would maintain the core temperature. It would go away from the fingers, away from the legs to maintain the core temperature. Well, the body's going to do the same thing. If the pressure or the oxygen level gets so low in the brain, the body's going to kick the legs out from underneath and get the head level with gravity so that blood will flow back in. What's that called? Passing out. Yes, yesterday was Cinco de Mayo. Passing out, right? So what happens is, if you pass out, so now think of this, there's a lot of drugs out there that lower blood pressure. What's the side effect of those? Dizziness, unsteadiness. Why? Because it's lowering blood pressure. Now at this sensor, which is right here, remember you got big red, the carotids coming up, splits. At that junction, you've got the carbon dioxide sensor and the blood pressure sensor. Now, your body regulates pH by regulating carbon dioxide. So if carbon dioxide level's high, that sends a signal down to increase the pressure or increase the blood flow to the lungs. Okay, if carbon dioxide levels are low, it's going to decrease the pressure to decrease the blood supply to the lungs to decrease that carbon dioxide transfer. Okay, does that make sense? So your body is always checking that carbon dioxide levels in order to maintain blood pressure. This is why I tell patients when they're going to get their blood pressure checked to deep breathe for 10 minutes. Okay, what's that going to do to the carbon dioxide levels? It's going to lower them. So if it lowers the carbon dioxide levels, you got sensors located in the neck, and those sensors are going to send the signal down to slow the blood supply or blood flow down to they're decreasing the blood flow to the lungs because you don't want a lot of carbon dioxide flow. Now these sensors are located in the neck. Now, if you compromise that nerve, do you think the sensors are going to function the same? What if, knowing that they're just located here, what if that body is shifted off to the side? Do you think that there's going to be a change in function of that autonomics? Yes or yes? Yes. Yeah, so you start looking at this. So the doctor of the future is going to be looking a little bit differently at physiology. They're not going to be just checking blood pressure. They're going to say, wow, it's high. I wonder why. They're not going to say, hey, you got high blood pressure, here's a diuretic, an ACE inhibitor, a beta blocker, and then we're just going to follow you until you pass out. Okay, none of that makes sense. Now, here's a typical guy. You could see that his spine was jammed off to the side. Whoops, here, let me do it the other way. There, that's better. Actually, that's bad. Okay, so now his body had some kind of trauma, yes? You can see his spine. So did that mean he was feeling good or in pain? So in pain, what happens when you're under pain? What do you think happens to the heart rate? It goes up, exactly. So a heart rate goes up, blood pressure goes up, immune system is going to be decreased because you're in a sympathetic dominant or a fight or flight pattern. This also means that pain is going to increase cortisol production because that's the best anti-inflammatory you have. And that chronic pain, your brain isn't going to really register because it's been there for a few years. So blood supply to his gut's going to be, decreased. So he's going to have poor digestion. And then what does he end up with? A cortisol-mediated metabolic state, or he's got high blood pressure, decreased bowel movement, indigestion. And he's taking all of those drugs. And it's kind of silly because is the body smart or stupid? Smart. So now for every 1 inch that heads forward, the pressure on the disc double. So if you get a body that's 2 or 3 inches forward, what do you think is going to happen to these muscles back here? Think they're going to be tight? They have to be. They're going to be tight to be pulling it in. Now, how do ignorant doctors treat a tight muscle? If you're an ignorant medical doctor, you're going to prescribe a muscle relaxant, which is a central nervous system poison. If you're an ignorant chiropractor, you're going to be loosening those muscles. However, if you loosen them, which way does the head fall? Forward. Yeah, so now what we do, we just fix them. No, I'm sorry. That's not the reaction I'm looking for. Really bad. Wow! Oh my gosh, the cervical spine restored. I'll say yeah. Okay, yeah. So now I'm going to teach you mnemonics because when I taught anatomy and physiology, you have to remember everything. So I'm going to teach you. C3, C4, C5 keeps you alive. Say it with me. C3, C4, C5 keeps you alive. That means that from this area of the neck, the nerve to the diaphragm, the breathing muscle, this muscle down here, so every time you go, that functions that this muscle comes out of the neck. So does that mean if somebody has a problem with the neck that we should perhaps check breathing? Or how about vice versa? If somebody has problems breathing, we should check the neck. It's starting to make sense, isn't it? Yeah, and so what's neat is this is a normal neck on the front and the side view. Here's 4 kids, and it's hard to see, but the one on the top left, and they range from 6 years old to 12 years old, we're seeing pressure on the top bone or cervical spine on the one on the left. In the middle one, he has a reverse curve. The one on the top right has a reverse disc at the top one. The bottom one in the middle has a reverse curve as well. These are 6-year-old to 12-year-old kids, children. Guess what they were diagnosed with? Say asthma. Asthma, that's so right. Okay, now what do the pediatricians say about childhood asthma? Don't worry, they'll probably grow out of it. Here, give them some steroids. They'll be fine. I'm a parent. Is probably good enough for me. No, it shouldn't be good enough for you either. And then also, too, what happens if you give a 6-year-old steroids? Okay, and discounting, but see, the medical system today, a pediatrician isn't going to look at these because the pediatrician doesn't have the skill set or the technology to reshape that. They come in here within 3 weeks, all of them are breathing correctly, but also let's look at the toxic influence. Now, obviously, to have that type of trauma on the neck, they had a traumatic birth. They were born in America. Okay, and America is one of the most dangerous places to be born in. I think we're 39th out of 72 industrialized countries. It's safer to be born in El Salvador or Croatia. Okay, much safer. Okay, and that's why I get people in here. I said, well, was your kid born natural at home or in a hospital? They said natural in hospital. I said, no, that's impossible. Okay, not in an American hospital. Were you given Pitocin and epidural? Oh, yeah, we were given Pitocin. Yeah, the kid just wouldn't come out. No kidding, because the birth process in America is viewed as a medical procedure. And if you put a child under a medical procedure instead of a natural birth process, you're going to get stats like 50% have a chronic illness or disease. This was an older slide. It's now 1 in 30 has autism. By 2021, the number of autistic kids will outnumber the kids without autism. So we're losing a generation, and one of the reasons is because these barbaric birth practices. And this is completely missed. It's completely missed. So if your child, and this is for all the people on YouTube as well, if your child has asthma or breathing issues or had ear infections, they have cervical trauma. What do you think would happen if these kids, because if I go in there and I stab somebody in the neck with a pen, they're going to say, ow, right? Look at that 12-year-old. What if you were stabbed in the neck for 12 years? Do you think you'd feel the pain still, or would you consider that a normal? You would consider it a normal. But what would it be like to pay attention? Would it be easy, or would you be in a sympathetic dominant state? Would you be a little bit fight or flighty? Yeah, so then you're being diagnosed with attention deficit disorder. Okay, and this goes on. So what do? You give them a class 2 narcotic, or actually treat the body with respect, look for the cause and fix it. Does that make more sense? Yes. It does to me. This is a great, great movie, The Business of Being Born. It's a shocker, too, because this is a vacuum extraction birth on the left. This is considered a normal birth practice. Okay, now what's frustrating in this country, they say most obstetricians have never seen a natural birth, because it's very hard to have a woman relaxed, have that cervix dilate, in bright lights, needle in the arm for an IV, baby monitor zipping by, and everybody in the janitor checking to see if you're dilated. Nope, it's only 8, not ready. Nope, it's almost 9, baby. Okay, that's a little stressful. Okay, I see all the moms in here. I was in the room for 2 births, okay, and I'm going, hey, wait a second, did you wash that paw? Okay, so, now here, what you're seeing here is a crime. Massive reverse curve. Remember what I told you before? C3, C4, C5 keeps you alive? What you're seeing is horrific amount of degeneration at the C5, C6 level. Terrific amount. Now, what that means is the nerve to the diaphragm has been compromised for years, and a reversal of the curve for years. So, since she's had the reversal of the curve, do you think her thyroid for sure is going to be low functioning? Her adrenals are going to be high. That means her risk of disease is great. Do you think she has a good oxygen transfer or pure? Or poor? Poor oxygen transfer. That means a more acidic system. What grows better in acidic? Cancer? Cancer, you're right. So she did have cancer. Was this the only cause? Was this the only toxic cause? Or do you think there might have been other factors? There more than likely were other factors. Okay, but right now, we know that she had an injury or trauma. She tore a ligament in her neck. It was over 15 years ago because that's the damage we're seeing. Extremely acidotic condition. She survived chemotherapy. She comes in here, and you can actually see a rudimentary disc forming. See, the body can regenerate it. Arthritis is not degeneration. Arthritis is not degeneration. It's a protective mechanism from an unstable joint, and joints can regenerate. Now here, this is one of the most important ones. Now there's a section in the middle of the brain that's oblong. Anybody in here speak Latin? Okay, well I'm going to teach you. Let's call the middle medulla, and it's oblong, so it's like oblongata. So it's the medulla oblongata. Anybody ever see Waterboy? Well, I like it. Now, what's tough is the brain doesn't stop at the skull. There's an oblong section of the brain called the medulla oblongata, okay, that sticks to the top portion of the neck. Now, what you're going to see up here on this left portion here, that bone shouldn't have a hole in it. See, the top bone of the neck is a circle. For you to see that big of a hole, guess what I got to do to that top bone of the neck? I got to turn it so far that you see a hole. So that means the top bone of the neck is spun so far that it's actually putting pressure on that brainstem area. That means that this woman here has had a problem, and she's had depression and bipolar disorder. And what do you think? High blood pressure, yes or yes? Yes. Okay, good. High cholesterol? Yes. Yep, because her body's trying to adapt to the pain. So all of these conditions, the high cholesterol, the high blood pressure, the pain and anxiety and depression and poor digestion, for over 30 years, it's from some type of torn ligament. No one ever caught it. This right here on the right is what a normal top bone of the neck looks like. It's a circle, but when you look at the circle from the side, it looks like a line. So what I'm showing you here is this what normal is. This, and you don't feel it, but you see the physiology. So when we look at this, and we're looking at the top bone of the neck, just like when we're looking at the kid's neck, when we're seeing reverse curves and pressure on the brainstem, this is the cardiac and respiratory center. This is the area that Christopher Reeves injured that shut his entire body down. If breaking that area can make you a quadriplegic, the pressure on it, do you think it's going to affect every organ system of the body? That's why there's multiple chiropractic techniques that just involve that top bone. It's that important. I know 2 of the 4 techniques. Now, when you look at this, in adjusting the top bone of the neck, it's that vital. You've got to have certain techniques to adjust just that bone. Now, this is an MRI showing pressure on that. But then again, we're seeing a reverse curve. C3, what was that mnemonic I just taught you? C3, C4, C5 keeps you alive. Do you think this person with that pressure on that spinal cord, with that reverse curve, is going to have healthy oxygen or poor oxygen transfer? What do you think blood pressure is going to be like? High. Okay, now also, we have to look at the musculoskeletal thing. Because when we look at this, 93% of all headaches are from the neck, cervicogenic. They're from the neck, okay? Now, if you know that, shouldn't the primary therapy be to, I don't know, let's talk crazy, check the neck? I know! It should be like, and this is medical facts. And then you're looking, about 7% of headaches are from alcohol, drugs, other toxicities. And you're talking 1/10 of 1% is from tumors. And now, how is a neck, I'm confused because I really don't utilize medical care for health because that's not what it's for. If this person had a headache, how is it treated? Tylenol, good. The deadliest drug in America. Okay, it's actually extremely toxic to the liver, and it is deadlier than all the narcotic drugs, the non-prescription like heroin and cocaine, deadlier than all of those combined. What's another one? Yeah, Tylenol's deadly, beyond belief. Okay, Advil, Aleve, Motrin. Okay, good. Those are poisonous to the kidneys. They destroy joint cartilage. Ibuprofen is in the class of drugs, non-steroidal anti-inflammatories. It destroys joint cartilage, and it damages the kidneys. So what you're telling me is, knowing that 93% of all headaches come from the neck, and modern medicine gives you a toxic poison to cover up the symptoms in the neck, I don't think that's an appropriate protocol. Now, this is a patient who actually came down from Apple Valley. Now, that from where we are, that's about a 2-hour drive. In bad traffic, it's a 4-hour drive. Okay? You've been to Apple Valley. This is her neck on the left, horrible. Her normal neck on the right, and that took about 90 days. No, not Wow! I know, it makes so much more sense. Okay, and so when we look at this, we actually call the curve in the neck the arc of life, because the brain extends to the top portion. It has a beautiful curve. It affects every aspect of the body. It's vital. Now, this is normal on the right. You know you work with that person on the left, yes? Okay, now, when that heads forward, just try it for a second, okay? Set up nice and straight. Put your head really far forward. Okay, with it this far forward, take a deep breath in. Now, just reposition the head. It's a difference, isn't it? Now, what you're doing with the head forward, you're compressing that top rib, can't move up. You're also compressing the trachea, so you can't really get a healthy oxygen flow down it. So there's a lot of things going on with this. But now with the body intelligent, since this is normal and what we're looking at is a neck like that, for every 1 inch the head's forward, the pressure on the disc double. That's going to spasm these muscles out like crazy. So do you want to relax those muscles or find out where they're tight? Find out where they're tight, because if you just willy-nilly relax them, which way is that head going to fall? Forward. I know, just insanity. So forward head carriage is huge. Now, postural muscles you don't have conscious control over. Now, this is super important because too many people, and they look at these muscles that run down either side of the spine. They're postural muscles. They run under proprioception. They're not under conscious control. They're not under conscious control. Too many doctors out there are relaxing muscles that are tight when you shouldn't be. If this body is in this fashion, this muscle on the outside portion of the curve is going to be tight. So what's the body going to do? It's going to spasm this muscle out to realign the body. So that means every scoliosis, the outside of the curve is spasming to realign that. It's trying to contract to realign it. Isn't that beautiful? I know, that's how the body is. That's why when we talk about our scoliosis correction, I talk about working only the concave portion. When people come in with a body that's bent and turned and twisted, they'll say, "Doc, can I get a massage?" Would you massage this person? No, of course not. But what I'll say is, look, you don't work on the shoulders at all. Work on the inside portion of the right side of that rib cage area. Okay, everything else you can do, you know, the massage for romance is great, but therapeutic, you don't want to work those shoulders. Okay, does that make sense? So there's a right time and a wrong time for it. When we look at this, on the left is normal. Every one of those other patients there, if you relax the shoulders, are you doing them a favor or are you killing them? You're killing them. You're compressing the nerves that supply the shoulder, elbow, wrist, hand. You're compressing the nerves that supply the diaphragm. You're going to cause the shoulder muscles. And what happens is, if you start massaging these people, what are they going to say? "Doc, I felt great after that massage. You know, I got to the car and I got home and I had this pain coming down my arm." Have you ever heard that? I know, some of you have experienced it. Not at our office because we don't do that kind of stuff. Now here, what we're looking at, the curve in the neck is called the arc of life. The one on the left is normal. The other two are Parkinson's patients. Now, Parkinson's, that has to do with lack of dopamine production in the brain. It also has to do with a lack of nerve supply to the brain. We've had several patients who've recovered from Parkinson's. Okay, now what happens is, this is normal. That is Parkinson's. Every patient I've ever seen has a loss or massive forward head carriage. And is that, remember, the brain functions like a battery. If it has that clear connection, if it's missing that clear connection, what the brain's going to do, it's going to send a motor impulse down. A motor impulse, which is what this is. So if that, and then the motor impulse opens and closes the joints to get some signals back up, because that brain needs constant sensory input from the body. This is going to shut down the nerve supply or the afferentation or sensory input from the body. This is going to restore the sensory input from the body. So if you have this shut down, what's the body going to do? It's going to open and close the joints. It's really that simple. If you have somebody with Parkinson's and their hand shaking, pinch it right here, just temporary, and you tell me if this shaking doesn't decrease. Why? Because you're overriding those signals, and you'll see that shaking decrease. If it does, if you've got the ability to restore that curve, you're going to change the symptom, and the shaking is going to stop. Here's a patient, 76 years old. Now, she had Parkinson's for 12 years. That's before on the left, after on the right. Do you see a change in the curve? Yes. Guess what? She went from a wheelchair to a walker to a cane. Wow. I mean, just brilliant, beautiful woman. Brilliant, beautiful. Now, I know this is tough. I could spend more time on structure, but we have to understand a little bit more about this. So we're going to go through and talk about the brachial plexus and the nerves that come out. We already know that C3, C4, C5 comes out of the base of the neck, okay? That's the nerve for the diaphragm. We know that the brainstem comes out of the top of the diaphragm, or top of the neck. We know that now the brachial plexus, or the nerve plexus that supplies the arm, comes out of the base of the neck. So this means that every shoulder or rotator cuff problem, every golfer's elbow or tennis elbow, every carpal tunnel syndrome is a double crush injury beginning in the neck. Has little to nothing to do with the arm. That's why 80% of the time carpal tunnel surgery has to be repeated in the other hand. When you've been told that it's a repetitive motion injury, that is not true. It's not true, because you'll see people that are doing that same job and they're just fine. People that are doing it like this, what do you think is going to happen? Compressing the nerve, forward head carriage. It's just obvious. But remember, today's most doctors, they're not taught to reshape the nerves. They're not taught to reshape that spine and get pressure off. So now here, again, we're going to learn another mnemonic. Out of the brachial plexus, right next to the spine, there's roots. And then they're called trunks. Then they're called divisions. Then they're called cords and branches. You know how we would remember it? Robert Taylor drinks cold beer. Okay, hey, it works. Robert, roots, Taylor, trunks, okay. Drinks, division, cold, cords, beer, branches. Okay, Robert Taylor drinks cold beer. And then it's 5, 3, 6, 3, many. Okay, now you might think, hey, wait a second. Okay, so that means there's 5 roots. Okay, there's 3 trunks, 6 divisions, 3 cords, and many branches. Now, why is that important? And I want you to know why it's important. Because if you have a lesion up here where the roots are, you're going to be covering just the area that nerve root supplies. See, the further away from any type of lesion, and I mean some type of pinched nerve, you're going to be involving more of it. So if you get down here to these cords and pinch that cord, you're going to be involving 3, 4, 5 different nerve root origins. So if somebody comes in and says, hey doc, I've got this pain that comes right here and it goes right to these 2 fingers, I can say, hey, that's a proximal lesion right next to the spine, that's C6. If you say, doc, I got this one that comes right down here, hits these 2 fingers, that's the C8 dermatome. I know exactly where that is. But if somebody says, doc, I got this numb area on the back of my hand like this, I'd say, you know, that's probably in the brachial plexus around here, because that's blocking off a number of different root origins. Okay, does that make sense? And you're going to see it too, because in, you know, really cool patterns like this, you're going to see single dermatome, which is a single area of skin supplied by a specific nerve root, or areas that are supplied by many. And this is why we'll ask certain questions, like what part of your body hurts? Or where do you feel the symptoms? I know, it's kind of cool too, isn't it? It's like detective work. So when we look at this, there's also not just the numbness. So if that head is forward, if they've got shoulder or rotator cuff problems, that means that the nerves could be pinched up there. But also, you've got this outlet to the thorax. Now, what's that big pump that resides right here? What's it called again? Heart. Oh, good, thanks. I know, I always get confused with that. Well, it's covered by this rib cage, right? Okay, now you can carry a great weight on your shoulder because that rib cage is huge. Okay, and it's actually placed kind of like a pyramid. So you can carry tons of weight on the shoulder. However, if the head's forward, there's all these rib cages, that head goes forward like this. You can compress the nerve plexus and the blood supply, or the blood supply and nerve supply to the shoulder. So that means those people that we were looking at with forward head carriage, their shoulder, blood supply and nerve supply are going to compromise to the shoulder, elbow, and wrist. Always, 100% of the time. So when we look at this, we've got a thing called the rotator cuff. Now the rotator cuff, and again, we talk an entire hour on the shoulder. We're going to cover it next month as well. This is just a rough overview of the rotator cuff, but I want you to understand how important it is, how it's linked to that neck area. So if that heads forward, it chokes off the blood supply and nerve supply. The rotator cuff has 4 muscles. Their main function is to suck this bone into a small cup. And that cup, I mean, they do some actions. They go out, in, up a little bit, but their main job is to suck it in. Now, if that heads forward, that chokes off the blood supply to the topmost muscle, and that's called supraspinatus. That's why it's the most commonly injured. And so what happens is, if you tear part of that or injure the rotator cuff, that arm doesn't fall down, it falls up. Because you've got this massive deltoid that's pulling constant pressure on it. So what do you got? You got strength here, but you go up to, ow, like there, it hurts. That's called impingement syndrome. Okay? So when we look at that, all the rotator cuff injuries have to do with forward head carriage, nerve impingement. All the rotator cuff injuries have to do with forward head carriage and nerve impingement. Unless you're laying down comfortably in a bed and somebody comes up and beats your shoulder with a baseball bat. Does that happen a lot? I don't think so. Okay. So 100%, I've been doing this 17 years now, almost 18 years. I've fixed hundreds and hundreds and hundreds and hundreds of rotator cuff injuries. Every one of them has to do with the neck. 100%. You get forward head carriage like this, it's going to compromise the blood supply and nerve supply. Now here's the crime. If you have a patient with forward head carriage like this, and you don't correct the forward head carriage, do you think the shoulder's ever going to get better? It's impossible. But what's her shoulder muscles going to be like? Are they going to be tight? Yeah, they're going to be trying to reposition it. So if you relax them, like the muscle relaxants, or the massage, or the ultrasound, it just leads to further problem. So there are a couple of exercises you can do. The easiest one is just a small weight, and you just dangle it. And these we cover in a lot of different respects. Now, bursitis. All the tendons connect to a joint, and we cover this a lot in our knee and foot lecture, but I want you to appreciate that bursitis just means there's lack of blood flow to the joint. See, you've got a muscle that connects up to a bone via a tendon, and those tendons surround joints. And since that tendon is always going to be moving against a joint, that would create a friction, so that would be bad. So what the body does is it puts a sac full of bursa fluid, which is a superfiltrated blood, to cushion that. So if there's no fluid in the bursa sac, it heats up, so it inflames. So that's called bursitis. I know, isn't that cool? Now, if the bursa sac inflames and there's not enough fluid, and that tendon starts to inflame, it's called tendonitis. Oh, isn't that cool? So now you start looking at it, when somebody says, yeah, man, I got this tendonitis in my elbow. Well, you don't have enough you don't have enough blood supply to it. And what are they going to look like? I don't have enough blood supply in my elbow. I don't know what it is. I keep taking the anti-inflammatory and it just doesn't work. Okay? Okay. Yeah, next time we're playing tennis, dude, get your neck fixed. Okay, so this is correctable. Carpal tunnel syndrome, same thing. This is also coming from the neck. It's a double crush injury. When we look at this, you've got muscles on one side, muscles on the other. These are called flexors, these are called extensors. You should have a strength ratio of 5-4. If the nerve in the neck is pinched, leading to a muscle imbalance, that tunnel is going to flatten out, or the muscles on this side are going to be stronger, puts pressure on the median nerve. What's ignorant is, how you make a muscle imbalance worse? Say brace it. You brace it. That's right. So you get somebody with a pinched nerve in the neck and you put a brace on it, and you make it worse. I'm going to show you a portable brace and an exercise that work. Can I have a volunteer? Yes, she's a plant. Okay. Not a plant, but like a plant. Okay, so now what we've got a muscle, okay, that should have a 5-to-4 ratio. Now, if this is stronger here, it's going to flatten out this tunnel and put pressure on it. So what we want to do is get pressure off of this median nerve, okay? Because let's just say she's really bad. Get forward head carriage so you look bad. Okay, no, she won't do it. Okay. So if she's got forward head carriage, this is going to wake her up at night. So what I want you to do, and this is what you can do at home, if that carpal tunnel is waking you up, put your thumb and pinky together, okay? Hold it right like that. And then you can get this electric tape, okay? And you put it right around the base of what are called the metacarpals. And just one little tape. You don't need to put it real tight. In fact, you want it fairly loose. And what happens is, now you can relax this, you'll see that that maintains the tunnel. She has full mobility of the wrist. Here, wiggle your fingers. Full mobility of the fingers, so she can type, she can do whatever she wants, and this will maintain the integrity of that. And what you do is you put it on the bottom of these bones here. They're called metacarpals, and it maintains it. And you only need it for a couple of weeks, because once we get the curve in her neck back, that restores this area, and everything works right. Now you're supposed to say, wow. Now, why do we use electric tape instead of some type of medical tape? For one, it's flexible. Okay? For two, it doesn't stick to fur. Okay? She doesn't have to worry about fur. Some of us do. Okay, now, and then you only need this if you really have severe, symptoms and it's really irritating you. Yeah, you got fingernails. Okay, good. And then you throw it away. But at the most I've ever seen anyone use it is for a week. Now we want to do some strengthening exercises. The bad way to treat carpal tunnel syndrome is to stretch it. You never want to stretch it. You never want to grab a ball. What you're going to do is you're going to put your hand like a flower bud and then make it into a claw. Flower bud to claw. Okay? Why, do you want to try it? Here. I was a paper boy. I can do that. Okay, so what you're doing, flower bud to claw. And when you want this, you want the hand to come out so it's just like a star. You'll see on her hand that this isn't coming out as far. That means that she still has a lower neck issue that we haven't solved yet completely. Eventually it'll come out all the way. But look at her demonstrate it. That's just perfect. And you can do it behind your back. You can do it over here. But what that does, that works these intrinsic muscles that put stress on that area, and it's going to solve it. Do you want one too? Okay, good. Do you want one back there? Okay, good. Thank you very much. Okay, and that's how simple it is. And so when you look at this, also when we get this, if that head has been forward for a long time, all those muscles that attach the head down here are going to decrease the motion there. If you decrease the motion of the rib cage, guess what has to happen to these discs? See, these discs get their nutrients through motion. And if you're decreasing the motion because that head's forward, the body is going to have these discs compress. Now, have you ever seen someone rounded over shoulders? That's to open up these holes in the nerves. Okay, they're called IVFs. If you round it over, what happens to those nerve holes? They get larger. So when you see somebody like this, that's not a bad posture. That's dehydration of the discs of the rib cage area. That's why we're going to talk about the thoracic area and the thoracic cage the first week of next month. And we're also going to go further into rehab joints of the rotator cuff as well. Arthritis is a mechanical distortion. It's not from age. This is 100%, okay, from trauma. And it's the body's adaptation to trauma. When we're looking at this is an extension x-ray. This is neutral on the left. This is a person looking up, and that's to identify the problems. Because arthritis can be reversed, but you need to have a gauge. And here's some natural anti-inflammatory foods because we don't want you uncomfortable. We just want you corrected. Okay. And this right here again, 69-year-old, 5 medications, before, 7 months later, drug-free. Why? Because we're just correcting the problem. We're correcting that neck, and that's the arc of life. That's the diaphragm muscle comes out of here. It's the heart and respiratory, cardiac and respiratory center. It's the breathing muscle. This is everything. Can you see it all ties in? It's everything. I mean, it's brilliant. Now, this is truly what you need to have a healthy neck. You need to have your nerve system checked. And when we look at this, and I know this is the same 5 things that we put up on everything, but can you see how if you decrease the breathing, that increases an acidic condition, that increases tumor growth, it decreases the body's ability to detox? I mean, this is everything. You got to get your nervous system checked. You got to have regular exercise. Why? Demonstrated brilliantly by Carmen. Okay, that is regular exercise. Okay. Also, no, you can't do it without a rubber band. Go on, ask me why. Because I said so. Okay. This is the simplest exercise we have for the neck, where you pull down, you have a pivot point, and you look up and straight ahead. It's that simple. Very, very easy stuff to get that curve in the arc back. And then you look at proper nutrition. Why? Because you can eat a plant-based diet that's going to have anti-inflammatory effects. Sufficient rest and prayer and meditation. Why? Because we're more energy than matter. If you have a connection with, God, or, why we're here, you heal faster. Now, all of these are available on our site, Owner's Guide. Okay, everybody gets the PowerPoints, the handouts, everything for free for 7 days. So I encourage you to look into that. And next week, we're going to talk more about lung health. Lung health, we're going to go more into the forward head carriage, more of the neck area, more of the rounding over the shoulders, but also literally how you can breathe the Z away, how you can correct COPD, asthma, bronchitis, everything. So thank you very much.